Hi everyone. That was a really hard presentation to follow. It was really helpful, and I think it'll be quite interesting to look at the budget of Healthway when you're looking at the budget of the Paul Ramsay Foundation. It's quite phenomenal. So I'm going to specifically talk about the health promotion project grants today, but I'm also going to touch on what Healthway does overall, because I often find that there's a bit of confusion about the different program areas and the different things that we fund and sponsor. So Healthway is an independent statutory body. Healthway's role defined in our Act is to promote and facilitate in Western Australia good health and activities which encourage healthy lifestyles. So we have a total annual budget of 23 million and we expend about 19 million of that through our grants and sponsorship programs. We also use 4 advisory committees to help us with the assessment and consultation phases. So we have a sport, an arts, a health and research committees that all help with the different types of applications that we receive. So Healthway was established in 1990 under the Tobacco Control Act, and recently last year in September we now have our own West Australian Health Promotion Foundation Act, and some of the key changes, I guess, that have come into play as we have a new board, which is actually a school-based board and not a representative board anymore in terms of representing different health agencies. So they're not all health promotion experts. We've got a bit more of a diverse range of skills. So we do report directly to the Minister of Health, and he does have a bit more involvement now and is now involved in approving all disbursement of funds, so that's just an extra step in the process with that. So we have 2 program areas, and I guess this is what causes a bit of confusion, because people often refer to sponsorship when they're talking about grants, or grants when they're actually talking about sponsorship. So we have a sponsorship program area, and so we sponsor sporting events but also arts and community events, and they have an annual budget of around 12.5 million. So you might be aware of things like Alcohol Think Again Wildcats, which are some of our larger sporting investments, or we have some really smaller under $5,000 sponsorships which might be small sporting clubs and things like that. So I work in the health promotion area where we have research and health promotion grants, and that's what I'm going to focus on today. But I'm happy to answer any questions about sponsorship as well, because I've worked in that as well. So we have an annual budget of 6.5 million. So the sponsorship program is obviously providing funding to those types of organisations. So I guess this is a bit confusing with sponsorship and grants, but in return for sponsorship, an organisation, they may be required to provide us with naming rights to their event or program of events, and in exchange we can promote a health campaign, a health message. So this was a Make Smoking History event at the Quarry through Melon Events, so obviously be a smoke-free area, and also they would have to limit the promotion of unhealthy products, and that's where our co-sponsorship policy comes in. So I think people ask, what's the benefit of funding, the Wildcats where you can serve alcohol there, but if we didn't have that Alcohol Think Again sponsorship, what unhealthy alcohol brands or other unhealthy junk food brands could be sponsoring it? That's all part of that strategy. So our priority health areas at the moment are those that lead to the most burden of chronic disease, and so it's obviously reducing smoking, harm from alcohol, preventing overweight and obesity, and promoting good community and individual mental health. So we're currently in the process of developing our new strategic plan, and we're hoping that it will be in place by the end of this year, and we'll know, and that will obviously guide the types of projects that we do support in the future. So I was a little bit reluctant to come today and talk, because I know it's an injury forum, but we have funded some injury projects as well and things that overlap. So our priority population groups are young people and children, Aboriginal and Torres Strait Islander people, disadvantaged communities, rural and remote communities, probably nothing too surprising there. So the funding categories for health promotion grants are up to $5,000. So these are generally submitted by smaller organisations who, for example, might want to focus on nutrition and do a number of cooking classes or workshops and develop a localised cookbook among disadvantaged families in a smaller community. Over $5,000 health projects don't really have a funding limit, because we often get asked that question. So we're quite a big contributor to a number of the statewide campaigns like Make Smoking History, the Act Belong Commit campaign, things like that. So you can imagine the types of the higher level funding, but we also would fund a lot in the mid-range kind of area. We also have Aboriginal health grants, which are up to $10,000, and they're similar to the $5,000 grants, but we just allow a bit of extra money because they're often wanting to be run in rural and remote locations and need that bit of extra funding. So this is the general gist of, I guess, what we support in the projects area. So grants to organisations engaged in health promotion. We fund discrete community-based projects and activities. The activities must not be the core business of your organisation. It has to be, we're not going to come along and fund something that was previously funded by something else and you just lost the funding and Healthwave step in. It has to be something new, and we generally fund a lot of pilot programs for that reason. Generally, we have to align with either a priority health area for us or be addressing one of our priority population groups. The grant timelines are up to 3 years, but we generally wouldn't encourage you to submit a 3-year application straight away if we haven't been in funding arrangements with you before and we don't know your track record in delivering projects. And we have open rounds, so we can take applications at any point in the year, but just be aware that we have a 4-month lead time for the over $5,000 grants, because it goes through an internal assessment process, and then we'll go through our advisory committee and to the Healthway board, and then finally to the minister. So we just need that kind of time frame. So we have funded injury prevention projects before. So we've got Jess here from KidSafe, so I'm sure she'll be happy to answer any questions about this one. This is probably our most recently funded injury prevention project. And I guess the reason why this was supported and was a bit of an exception to the rule around priority health areas is that it did have a significant focus on children and young people. And this particular project, they had demonstrated they had really strong partnerships with a number of different health agencies that were going to contribute to the content of the resource, and they also had strong, they'd already consulted with the relevant education bodies and teachers and things that were going to have an input. And it was also sustainable, so the project's not going to fall over as soon as the Healthway funding isn't present anymore, and it will continue to be used ongoingly. So I just encourage you, all our application forms and guidelines are up online, but I would encourage you to read the eligibility criteria before looking to create an application. It can be quite onerous depending on the size. And obviously the lead time required is a pretty basic one. And if it doesn't address the Healthway priority health area or priority population group, I definitely encourage you to speak to myself or someone else first, and we can sort of give you the best advice. It is quite a supportive and collaborative process. We don't want people to be wasting time filling out an application, submitting it, and then it sort of doesn't go anywhere. So we definitely encourage you to call us first, and we can also review draft applications and provide written or verbal feedback, whichever you prefer, just so that the application that comes into our offices, you've got the best possible chance of it being supported. So I think the key things in writing an application, particularly for the larger projects, would be to consult with the relevant health agencies and experts. So if you're wanting to run a mental health project, I guess we would expect that you would speak to the Mental Health Commission, that you would have spoken to the Act Belong Commit campaign, and that we know that this work won't duplicate the work of others, and that you have their support. So I guess beyond the tokenistic kind of letters of support, we would expect that you would do a lot of consultation in that initial phase, and Healthway's also moved towards doing a lot of that consultation as well. So we will speak to a lot of agencies in the assessment process and make sure that the project is supported and they do have that buy-in. Make sure you have really clear objectives and deliverables that can be measured. be realistic. Don't, make them too difficult to achieve. We also have a service agreement with the Health Promotion Evaluation Unit at UWA, and so we understand that a lot of agencies won't have the health promotion expertise or the experience in developing a grant, so we can engage them to help you with particularly developing a strong evaluation plan and some clear objectives depending on what you're wanting to achieve. Also, making sure that it has some level of sustainability with the project. We don't want to fund things that are just on a short-term basis and won't have any long-term, impacts. So things that are generally not eligible within the health projects, funding for existing programs like I mentioned before, what we deem would be your core business, purchasing of equipment and capital items, funding for one-off events and workshops is a really common one, infrastructure costs, so operational running costs associated with your organisation. They have to be project-specific costs. Overseas and interstate travel, fundraising activities, anything that sort of extends beyond primary prevention, so gets into the health services, screening, treatment, counselling, that kind of realm. These are my contact details. Like I mentioned, all eligibility criteria and application forms are online. We're in the process of getting them put into an online process now, but they're still hard copy, unfortunately. At the moment, it's still kind of behind the times. But I would encourage you to sign up for our e-news, because when the new strategic plan is finalised, it will be communicated via that. I'm happy to answer any questions anyone might have. Yes.
Emma, do you think there'll be much change from the old strategic plan to the new strategic plan in terms of your priority areas?
I can't imagine it would deviate too much from what we have right now. It is based on the burden of chronic disease, so those key areas aren't going to change much. And like Department of Health have just released their strategic plan, they've got the same areas but also with a injury focus. I'm sure she'll speak more about that if you have any questions. But there might be some different, I think operationally there might be different ways that we may go about the way that we do grants and sponsorship at the moment. We've been doing it like this for a very long time, so that might change. We have changed the way that we do things internally, and I think having a new board, and we are developing an operational plan alongside the strategic plan, so really anything is possible, but I think those key areas will still be in place. That's just my opinion, but there may be some other health areas that are added to the list as a sub-priorities. Thanks. Anything else?
Please join me in thanking Emma.